Have you ever seen someone spend real money on a laser treatment, follow the instructions, wait through recovery, and still walk away saying, that didn't work? Well, here's the uncomfortable truth. In most cases, the treatment did exactly what it was supposed to do. But the disappointment comes from a mismatch between what the laser can realistically improve and what the patient expected it to fix. In this video, I'm going to break down the real reason laser treatments disappoint, what laser resurfacing actually improves, and why one session is almost never enough, and why there is no such thing as the best laser, and how the right diagnosis and treatment plan completely changes outcomes. If you're considering a laser treatment, or you've had one and you feel underwhelmed, this is the framework you need before spending more time and money on another treatment. So laser resurfacing treatments can be incredibly effective, but they're often misunderstood. A lot of frustration comes from the idea that one procedure should correct every visible issue at once. Textures, pores, pigmentation, redness, fine lines, skin laxity, acne scarring, and overall skin quality. That expectation sounds understandable, but it's biologically and technically unrealistic. The goal of this video is to help you understand how laser treatments actually work, so you can judge results correctly, choose the right treatment, and avoid the kind of disappointment that comes from false expectations rather than poor care. Let's start with the biggest problem: expectation versus reality. Many patients come into a treatment hoping for a full correction of multiple skin concerns after just one session. They may want smoother skin, smaller pores, less pigmentation, softer lines, more even tone, and a dramatic glow all at once. But laser procedures are specific tools. They're not magic and they're not interchangeable. Each device is designed to target a specific and limited set of problems. One laser may be useful for pigmentation. Another may focus on redness or vascular concerns. Another may improve texture and stimulate collagen. A more aggressive resurfacing treatment may help deeper lines or scarring, but it also comes with more downtime and definitely more risk. So when someone expects one treatment to deliver every benefit, disappointment becomes almost inevitable. And this is why patient education matters so much. When people understand what the treatment is intended to improve, how long results take, what recovery looks like, and what the limitations are, satisfaction goes up dramatically. Not because the laser has changed, but because the expectation became realistic. A strong consultation is not just paperwork before a procedure. It's one of the most important parts of a successful outcome. It clarifies goals, identifies the real problem, explains what is and is not achievable, and creates trust in the process. Unrealistic expectations are the hidden cause of dissatisfaction. One of the biggest drivers of unrealistic expectations today is the way cosmetic treatments are portrayed online. Social media, advertising, heavily filtered before and after photos, and viral clips can create the impression that laser treatments are instant, dramatic, and universally transformative. They make it look like one appointment can erase years of damage, but real skin does not behave that way. It does not behave like edited content. Laser results are gradual because skin biology is gradual. If a treatment works by stimulating collagen, remodeling texture, or even in pigment over time, the results are not supposed to appear overnight. Improvement often unfolds progressively across weeks or months, and that matters because many patients judge a treatment way too early. They may compare their real experience to a polished online narrative and conclude the treatment failed, when in reality, they are simply in the normal part of the healing and remodeling timeline. Managing expectations before treatment is one of the strongest predictors of satisfaction. Patients should focus on realistic improvements, especially in areas like texture, tone, pores, fine lines, rather than expecting total perfection. Better skin is most certainly achievable. Perfect skin, not the standard. Now let's get specific. What does laser resurfacing actually improve? First, it can refine skin texture. By stimulating collagen and elastin production, laser treatments help the skin look smoother and more uniform over time. This is one of the most reliable and meaningful improvements when the right treatment is selected. Second, it can reduce the appearance of visible pores. Large pores are often tied to oil production, skin quality, and textural irregularity. Laser resurfacing can make pores look less noticeable by improving the surrounding skin. Third, it can help with uneven pigmentation. Lasers can reduce the appearance of discoloration, help create a more balanced complexion, and depending on the type of pigment issue, the best approach may differ, but even in the skin tone is a common and realistic goal. Fourth, it can soften fine lines. Notice the word in here, soften, not erase or airbrush. Fine lines often improve gradually as the skin remodels and gains a healthier texture. This is the key message. Laser resurfacing is strongest when the goal is to improve the quality of the skin. That means a smoother texture, better tone, less visible pore prominence, and softer fine lines. If the patient expects every concern to disappear completely, they are likely to be disappointed. And if they understand that the treatment is meant to improve the skin in measurable, realistic ways, the results make much more sense. Another major source of disappointment is the idea that one session should do everything. In reality, multiple sessions are often necessary for both effectiveness and, most importantly, safety. That is not a sales tactic. It's biological reality. Skin changes over time, and good treatment plans respect that. Each session contributes to collagen stimulation and progressive improvement. Think of it as building momentum rather than flipping a switch. The skin needs time to respond, heal, and rebuild between treatments. That spacing is not a delay in the process, it's part of the process. And healing between sessions allows the tissue to recover, remodel in a controlled way. This is how results become more natural, more consistent, and more sustainable. Trying to rush beyond what the skin can tolerate safely increases risk without guaranteeing a better result. And patients who understand from the beginning that treatment is a series, not a one-time event, tend to stay committed, judge progress more accurately, and end up happier with the outcome. Now let's talk about one of the most persistent myths in this space, the idea that more downtime automatically means better results. Longer downtime does not always mean a better outcome. Aggressive treatments can be powerful, but intensity alone is not the same as appropriateness. A more invasive laser may deliver strong resurfacing in the right case, but if the patient's concern would respond well to a gentler approach, extra downtime is not a badge of quality, it may simply be unnecessary. Another misconception is that CO2 is always the best option. It isn't. CO2 is one tool. In the right patient and for the right indication, it can be valuable. But it is not automatically superior in every situation, and it is not always the wisest first choice. There is also a dangerous tendency to underestimate the role of aftercare. Aftercare products and recovery instructions absolutely matter. They influence healing, comfort, inflammation, and the final quality of the result. Ignoring aftercare can compromise an otherwise well-chosen treatment. And finally, one of the worst comparisons patients make is assuming my journey will be the same as what I saw on TikTok. It won't. Your skin, your history, your goals, your tolerance for downtime, your healing response are yours alone. You are completely individual. And a clip online is not a treatment plan. There is no best laser. And this is one of the most important takeaways in the entire presentation today. There is no single best laser. There are only lasers that are more or less suitable for a specific problem in a specific patient. Different technologies are built for different purposes. Some target pigmentation, some are better for texture, some treat redness and vascular issues, and some stimulate collagen more deeply, some create more aggressive resurfacing. The best choice depends on what you are actually trying to fix. And this is why personalized treatment matters. If you match the technology to the patient's skin concern, goals, and tolerance for downtime, you get better and safer results. If you choose a treatment based on hype, trendiness, or the assumption that one machine is superior to all others, you increase the risk of disappointment. Now, expert guidance is essential here. Proper evaluation helps determine which technology is appropriate and which is excessive, insufficient, or simply wrong for the concern. Let's briefly walk through the treatment categories covered in this presentation so you can understand the logic behind selection. RF microneedling, such as Secret RF or Morpheus8, is presented as a treatment that promotes deeper collagen stimulation and skin tightening with a minimally invasive approach. That can be useful when rejuvenation and structural support are priorities. Fractional ablative lasers, including gentler resurfacing options such as cool and erbium-based approaches, can improve texture and tone with relatively limited downtime compared with more aggressive options. These are often attractive because they create visible improvement without pushing the recovery burden too far for the right patient. Fully ablative resurfacing, such as CO2, may be used for more intensive resurfacing when targeting deeper wrinkles or scars, but this comes with more downtime and a higher risk profile, which is exactly why it should not be treated as automatically the best. Erbium YAG is also a safe alternative in many situations, and that highlights a critical point. A more balanced risk-benefit profile often matters than raw intensity. And then there are treatments for pigmentation and vascular concerns. The PicoStar, which is a type of pico laser, is identified for pigment issues, and the pulse dye laser, such as VBeam, addresses redness and vascular problems. And again, this reinforces the central principle: different concerns require different tools. So when a patient says to me, I want the best laser, the better question is, best for what? Because until you answer that, the question is too vague to be useful. So what actually leads to great results? First, accurate diagnosis. If you don't identify the problem, you can't choose the right treatment. Pigment, redness, scarring, laxity, texture irregularity, and enlarged pores may coexist, but they're not the same issue and they don't respond in the same intervention. So they may need multiple lasers. Second, a tailored treatment selection. The treatment has to match the individual, not just the symptom. Skin type, risk tolerance, downtime tolerance, prior procedures, overall goals all matter. And third, a structured treatment plan. Great results do not usually come from one dramatic appointment. They come from a deliberate sequence, correct diagnosis, proper treatment choice, and appropriate timing, together with realistic expectations and reassessment along the way. Fourth, patient-practitioner collaboration. Patients need to be honest about their goals and willing to commit to the process. Practitioners need to educate clearly and set realistic expectations. When both sides are aligned, satisfaction improves because the outcome is being judged against smart plan rather than a fantasy. So if you're considering a laser treatment, here's the right next step. Seek a personalized consultation. Pay for it. Not a rushed recommendation, not a trend-based opinion, not a one-size-fits-all package. A real consultation should assess your concerns, identify your skin type, clarify your goals, and explain the realistic path to improvement. You need to understand what your skin actually needs, what each treatment can and cannot do, how many sessions may be required, what recovery will look like, what the aftercare looks like, and what success should realistically mean for you. Informed decisions produce better outcomes. The more clearly you understand the relationship between diagnosis, treatment choice, healing, and expectations, the more likely you are to feel that your investment was worth it. So let's bring this all together. Laser treatments do not usually disappoint because lasers don't work. They disappoint because expectations are vague, inflated, or borrowed from social media. People expect one treatment to solve multiple problems, expect immediate transformation from a gradual biological process, or chase the idea of a universally best laser when no such thing exists. The patients who get the best results usually do 4 things well. They get an accurate diagnosis, they choose a treatment plan that matches their actual concern, they're committed to a structured plan, and they evaluate progress realistically over time. That is how you move from disappointment to satisfaction.